Hello, everyone. My name is Dr. April Armstrong. I'm Associate Dean of Clinical Research and Professor of Dermatology at the University of Southern California. I'm very excited to talk to you today about epidemiology, etiology, and classification of chronic hand eczema. Here are my disclosures. First, let's talk about definitions. In this talk, we're going to use the term eczema and dermatitis synonymously. So when we think about hand eczema, also known as hand dermatitis, it's typically defined as an inflammatory skin disease of the hands and wrists. When we think about acute hand eczema, that's typically defined as eczema localized to the hands that lasts for less than 3 months and does not occur more than once per year. And then how do we think about chronic eczema? When we look at definitions for chronic eczema, what we see is that chronic eczema is typically defined as persistence of hand eczema for more than 3 months, or when the condition recurs twice or more often within a 12-month period of time. So this is important with regards to thinking about the time frame and chronicity of chronic eczema. And this definition is based on the European Society of Guidelines on Contact Dermatitis, which we'll refer to later as well in the talk. Now let's talk a little bit about the global prevalence of chronic hand dermatitis. And perhaps first, let us talk about the difference between point prevalence and lifetime prevalence. Point prevalence is a proportion of population that has a characteristic at a specific point in time, whereas lifetime prevalence is where we have a proportion of population where we calculate who at some point in their lifetime has ever developed that characteristic. So as a result, when we look at lifetime prevalence, it's typically a number that's larger than point prevalence. When we look at the global general population, depending on the region, the point prevalence of chronic hand eczema is anywhere between 2.7 to about 18%. And the lifetime prevalence ranges between 8.4 to 41.8%. When we look at the dermatology clinic population specifically, what we notice is that in adults, the point prevalence is between 5 to 48%, depending on the country that we're looking at. And the point prevalence in children in the population that we see in the derm clinics is between 19 to 26%. Here is a look at the various dermatology clinics across the globe, as well as the general population with regards to the prevalence. As you can see, in Australia, in the European dermatology clinics, we have a big prevalence that's there, and the range is also quite large as well. And in South America, it's relatively lower. North America, the point prevalence is anywhere between 18 to 47%. And then below the orange line is where we see the general population. As you can see, not surprisingly, when we look at the general population, the point prevalence is a little bit lower than that of the population that present to the general dermatology clinic. So here's a question for us. Do certain occupations put people more at risk for the development of CHE? And if we think about this particular question, and if you were faced with this multiple choice question, which of the following occupations has the highest lifetime prevalence of CHE in Europe, what would your answer be? Well, if you chose baker, you would be correct. So let's take a look at occupations and their relationship to CHE. So here is occupation-related lifetime prevalence of chronic hand eczema in Europe. As you can see, hairdressers typically rank very high with regards to their lifetime prevalence of CHE. And that particular prevalence can vary depending on the study. And you can see the range is actually pretty wide, anywhere between 8% lifetime prevalence to 44%. Following that, we have apprentice nurses, manual workers, and food handlers. So bakers, confectionery workers, as you can see here, those are all occupations that can put people at higher risk of developing CHE. This chart shows the incidence of chronic hand eczema per 1,000 patient years. And as you can see here, again, not surprisingly, hairdressers rank the top, followed by butchers, bakers, kitchen workers, and then blacksmiths and mechanics, following that dental technicians, and then also healthcare workers. And then below is general population and a few other occupations. Now, when we think about the risk factors for the development of hand dermatitis, other than the occupations that we just spoke about that have been associated with higher prevalence of chronic hand eczema, let's think about other risk factors. And those include the following: previous episodes of hand dermatitis, a history of atopic dermatitis, a history of contact allergy, if you do wet work all the time, and also if the patient presents with early onset of hand dermatitis. Now, let's go on to talk about classification and etiology of CHE. Probably one of the key messages to remember is that there is a lack of consensus regarding chronic hand eczema classification and management at the global level. And classification systems can vary. Various groups can classify chronic hand eczema based on their location or morphology or etiology. So again, the key thing to remember is that there's really no current international consensus regarding the classification. So I'm going to go through a few ways we can think about classifying, and then later on we're really going to focus on the ESCD classification. So first, there are proposed location-based chronic hand eczema classification. For example, people have proposed distinguishing, for example, interdigital eczema versus pulpitis. So as you can see under this classification, this type of classification is really looking at where the specific lesions occur on patients' hands and then classifying patients accordingly. There are also suggestions of morphology-based chronic hand eczema classification. Here what we see are examples of hyperkeratotic palmar hand eczema. And what we know about this is that typically this type of hand eczema can be distinguished from psoriasis in that there are no typical nail changes that we can see in psoriasis involving the palmar plantar areas. Importantly, the hyperkeratotic palmar hand eczema typically affects middle-aged men. And now when we look at nummular eczema, this type of eczema oftentimes affects the dorsal aspects of the hands or fingers. Other specific morphologies that have been described with a chronic hand eczema include chronic fissured eczema, what we see on the left-hand side, and on the right-hand side where we can see these recurrent vesicular hand eczema, as you can see vesicles along the sides of the fingers as well as on the palmar areas. So here are some general considerations when we talk about classification and when you read about the various different classifications. One of the key things that one will realize is that oftentimes the pattern of dermatitis is polymorphic. And importantly, the morphology is unfortunately not at all related to etiology. And that can be a bit problematic. And in acute phases, typically erythema or vesiculations are predominant. And in chronic phase, fissures and hyperkeratosis is predominant. And some of the classification systems typically focus on etiology, and those can be oftentimes divided into irritant, allergic, or atopic. And the one example that I want to highlight, for example, is the Canadian hand dermatitis guidelines, where they highlight the 3 clinical types under chronic hand eczema as having irritant hand dermatitis, allergic hand dermatitis, or atopic hand dermatitis. But one thing that I wanted to focus on today, have us to go through it together, is a classification of hand eczema based on the European Society of Contact Dermatitis. And this is because this classification system has been used in a number of different settings and also highly cited in the literature. So when we look at this particular classification system, again, there's agreement. Some experts agree with this, and there are also disagreements regarding this as well. But let's take a look at this as a framework to think about classification of hand eczema into different categories. The 2 larger categories, as you can see here, are the exogenous hand eczema and the endogenous hand eczema. And under the exogenous hand eczema category are things like irritant hand dermatitis, allergic hand dermatitis, and contact urticaria or protein contact dermatitis. And they're classified under exogenous because exogenous materials oftentimes can play a large role in the pathogenesis of hand eczema here. The other larger category is the endogenous hand eczema, and these include atopic hand eczema, Pomfrey's hand eczema, and hyperkeratotic hand eczema. So let's take a look at all of these 6 different categories of hand eczema. So under the larger umbrella of exogenous hand eczema, first we'll talk about irritant hand dermatitis. This is where hand dermatitis is due to prolonged or repeated exposure to primary irritants. And the diagnosis is based on 2 factors. Number 1 is a documented exposure to an irritant that's quantitatively likely to cause contact dermatitis, and one must show that there's an absence of the relevant contact allergen. So this is important. An example of the irritant hand dermatitis is really wet work. People who really are working in environments where their hands get wet quite a bit. Now let's go to allergic hand dermatitis. Allergic hand dermatitis typically is caused by delayed type reaction or type 4 reaction as an immunologic response to an allergen in a sensitized individual. Typically, for this diagnosis, one requires a positive patch test and a relevant current exposure to the allergen. And while the early lesions are at the site of allergen contact, but the spreading can occur at more distant sites as well. Again, it's very difficult oftentimes to distinguish between irritant and allergic hand eczema clinically or histologically. And now we're going to go to the third type, which is contact urticaria or protein contact dermatitis. Now, protein contact dermatitis is a more rare form and distinctive form of allergic or irritant hand eczema. As a result, it can be IgE mediated or even through non-immunologic mechanisms. It's called protein contact dermatitis because 4 groups of proteins can cause this entity. And these 4 groups of proteins include plant, animal, flower, or proteolytic enzymes. One of the examples is the natural latex rubber as a cause for protein contact dermatitis. Other examples include food allergens. And the diagnosis for this is typically based on exposure to the relevant proteins and a positive prick test. So again, this may be a result of combined type 1 and type 4 delayed hypersensitivity reaction, and there are also some non-immunological mechanisms that underlie its pathogenesis. Now we're going to the endogenous hand eczema category, and let's go to atopic hand eczema. Atopic hand eczema occurs in patients who have previous or current atopic dermatitis, and importantly, no documented exposure that could likely cause irritant contact dermatitis. Mutations in filaggrin are commonly seen in these patients, and they have a decreased epidermal barrier function. And in these patients, the cellular immunity may be also decreased as well. What about the next category? Now let's take a look at Pomfrey's hand eczema. In Pomfrey's hand eczema, it is considered an endogenous form of CHE with vesicular eruptions. And it's important to note that one must rule out any relevant contact allergies, and the person must not have documented irritant exposure that could potentially cause the hand dermatitis. Oftentimes, these patients develop these isolated vesicles on the palms of the hands or the sides of the fingers. And clinically, these vesicles can last 2 to 3 weeks and oftentimes resolve with desquamation. We want to avoid the use of the term dyshydrotic eczema because there's no really sweat gland involvement. So here are another examples of Pomfrey's. As you can see, these tapioca-like or these vesicles on the sides of the fingers, and as you can see also on the palms of the hands. And now let's go to our last category, which is hyperkeratotic hand eczema, which I alluded to earlier when I talked about morphology and morphology-based classification. So in the hyperkeratotic hand eczema, in this particular classification system, as you can see, chronic hand eczema presenting with hyperkeratosis in the palmar hands or pulpitis as well. Important, the patients must not have documented irritant exposure. Oftentimes in these patients, the causative factor or the causative agent is unknown. And these patients oftentimes, interestingly, do not present with concurrent vesicles. So as you can see, We reviewed the ESCD guidelines for classification of CHE, and there's a subsequent paper by IEC counselors talking about some of the agreements and disagreements with regards to their reactions to the guidelines and how we can potentially all come together and think about where the gaps are in terms of research as well as consensus. And so with that, I want to thank you for your attention.